I'm Dr. Truesdale, and I'm gonna answer your question, should I have a facelift? Am I ready for a facelift? So in this video, I'm gonna discuss everything that you wanna know when answering the question of, am I ready for a facelift? I get this question a lot, and the first question that I'll answer is, am I too young or too old for a facelift? I will tell you, I've done facelifts for patients in their 30s and patients in their 80s. There is no perfect age for a facelift. It really depends on your goals and your laxity. So let's talk about what a facelift does. A facelift repositions the tissues of the face, in particular, the muscle layer and the fat that lives on top. So it also addresses loose skin, but primarily what we're doing is we're moving tissues back to where they previously were. As we age, tissues fall. And so my job as a plastic surgeon is to fight gravity and put them back to where we want them to be. So if you're young and you have loose skin or loose muscle, you can benefit just as much as someone who is old, who has loose skin and loose muscle. Now, it is up to you and the plastic surgeon to sit down with each other and say, is this worth it? Because every procedure has a risk and benefits. And so some people don't have enough laxity to justify as lift, but some people have enough laxity. It really depends on what your tolerance is for laxity in your face. So let's go through top 10 signs that you might be a candidate for a facelift. Number one, if you are looking at yourself in the mirror and you like what you see, when you take your fingers and you lift up like this, likely you are a candidate for a facelift. And how do we know that? Well, what you're doing is you're telling me that I like the position of my face when things are physically lifted, right? If you like the way your face looks by moving the tissue, that cannot be accomplished with any other non-invasive means, right? There's no skin tightening device, there's no thread lift. That's going to physically move things up in a long-term way, okay? So you are a candidate for a facelift. Number two, you have loose skin and jowling in the lower face. If you see an extra line of wrinkling here, or it looks like it's just an extra bit of tissue, in particular if it's hanging over the jawbone here, you are a candidate for a facelift, because that tissue, although we can minimize the appearance of that laxity by adding in volume in this area along the bone, the pre-gel sulcus, or do minimally invasive things to try to tighten up the skin, none of that makes it fully go away. So if you have a lot of jowling, the best way of repositioning that tissue is with a facelift, and a facelift will do that for you. Number three, if you feel like your face shape has dramatically changed over time, meaning it's gone from more of a diamond to a square or almost a pyramid, then that is a very clear sign of aging. As we age, we go from a more oval to a more square face because the tissues that are up higher, right, come down, and it makes the lower face more heavy. So if you feel like my face just doesn't have the same contour and it doesn't have the same aesthetic or snappiness or snatched-like appearance that it did when I was younger, you likely are a candidate for a facelift because it treats and addresses that concern. If you have deep nasolabial folds, the nasolabial fold runs between the chin and the mouth subunit and the face. As we age, those tissues come down, and as it comes down, it deepens the thickness of that fold. And so if yours is very deep, then you likely would benefit from a facelift because it repositions that tissue up higher. And you can see, even with me, I'm exaggerating that, but when I move the face up, it smooths that area out. Now, I never expect that area to be perfectly flat. If it is, that is a bad sign of a facelift. That's another video that I'll do some other time. But if you stretch the face too much, it just looks really flat. It is natural and normal to have a little bit of a dip there. We just don't want it too deep. So if it is, a facelift, a deep plane facelift, can reposition that tissue. Number five, if your cheek is now lower and you're saying, Doc, my cheek used to be up here, or I used to have really nice cheekbones and now I don't, you are a candidate for a facelift. And so a facelift, again, moves that descending tissue, that extra fat and loose muscle back up. When that muscle layer comes up vertically, the fat and the skin that is positioned on top of that layer also comes with it. And so that is a good sign that you are indeed a candidate for a facelift. Number 6, so if you have a lot of fine lines and wrinkles in your face, right, more than likely you would benefit from a facelift. It will help to some degree with your skin quality, but it's not going to be the only thing that you'll want to do. In addition, you'll probably want to add in some fat transfer or a resurfacing with a laser or a peel, something that can help smooth the surface wrinkles and texture. Number 7, you've tried fillers, you've tried threads, and you like the way it looked initially, but it just isn't hitting the same way anymore. That is a good sign that you indeed are a candidate for a facelift. Let's be honest, when we put threads in our face, we are trying to lift the face, right? Thread lift. I am not a big fan of thread lifts. I don't think that they last for very long. I don't think they're actually doing the true effect. But in essence, you're answering the question. If you are considering a thread lift, it's at least a discussion. It's at least worth a discussion with your plastic surgeon about doing a facelift, because what you're trying to accomplish, although it's temporary, is something that can be achieved with a facelift. Same thing is with filler. A lot of times people abuse filler, and people are trying to actually lift the face with filler by just plumping and overfilling the face. Not a good idea, but that is a reason for you to get a facelift. Instead of just trying to plump things up, or if anyone's ever told you that filler can lift the face, they're lying, it's fake, it's false. And the reason why is all you're doing is just recontouring the face, and it gives the appearance of a lift, but it's actually not lifting the face. If you have platysmal bands, this is a reason, number 8, why you might be a candidate for a facelift. Platysmal banding are the lines that form in the neck here. And if you see 2 discrete little lines going up and down in your neck, you're likely a candidate for a facelift. When I say facelift, I lift the face, but I also lift the neck, okay? And so a part of any facelift, I always consider doing something called a platysmal plication. A platysmal plication is where I'm sewing together those bands and lifting up from the side to create a very smooth contour. I also do any type of deep neck lifting at that same time, where I'm contouring the fat and the glands that sit in the neck to create a beautiful, crisp, and etched out jawline. Now, there are 3 different patterns of the platysma. Platysmas can be completely dehiscent, meaning one side of the muscle and the other side of the muscle are not touching. They can actually be partially crossed over or fully crossed over. Each level depends on your anatomy. But if you're thin and the muscle itself is fallen, you will see those muscles. If you are a little bit bigger, have a little bit more fat overlying those muscles, you might not see your platysmal banding, but it might read as a waddle or a turkey neck or a double chin. That is also likely that you have some platysmal banding, the platysma has fallen, but that gets addressed when doing a neck lift. Now, if you're very, very thin, no amount of neck lift, no amount of facelift will make those bands completely invisible. What we're trying to do though is actually bring them up under the jawbone so they're not hanging as 2 individual serpent-like bands, okay? Number 9 reason why you might be a candidate for a facelift. If you wear face tape, you are likely a candidate for a facelift, because what you're trying to achieve with that look is actually lifting the face, okay? Number 10, you might need a facelift if you look in the mirror and you just don't recognize what you see anymore. If you feel like, gosh, that person that's looking back at me, they look old, and I don't feel that same way. More than likely, if you have that sensation, a facelift will help, because a facelift, if it's done properly and artistically, is just moving your tissues back to where they used to lie. And usually in my patients, that just uncovers the younger version of you. So these are 10 reasons, 10 considerations of, if you're thinking about them, you might be a candidate for a facelift. Hopefully you guys learned a little bit.